A taping technique for a medial collateral knee ligament. So our first anchor is going to be using 7cm EAB, and it's going to be wrapping around the distal of the quads. So it's really important that these are positioned above hamstring tendons. It's free from tension. We're using EAB because it's got give in it, and it allows some dilation of tissues, and it won't impair contraction when the tissues are working. Our distal anchor point is going to be, our point of reference will be fibula head and also tibial tuberosity. So we're beneath hamstring tendons using 7cm EAB, and we're wrapping around the top of gastrocs, free from tension, until we come around toward the start again. So the knee's positioned with 30 degrees of flexion, because that's where the collaterals are most susceptible and most vulnerable to injury. So we're supporting it when the patient, or where in a position where the patient most needs support. So to support that structure, then we're using 5cm zinc oxide tape. Our medial collateral knee ligament then is going to be in this position here. So we need to make sure that our zinc oxide is covering whereabouts the MCL is positioned. So we're bringing those down, maintaining 30 degrees knee flexion, adding tension through the tape, down through here. And we're creating a fan, and these want to cross over where the MCL is positioned. So the next strip is going to be travelling anterior to posterior, and you can see the fans crossing whereabouts the MCL is positioned. So our next strip is going to be anterior to posterior. Next strip, posterior to anterior, crossing in the same position as our two previous strips. So to offer a bit more support, then we're going to go over all of those three strips of zinc oxide with further strips, just so it's adding enough support for that ligament we're trying to protect. So straight down the middle again, with tension through the tape. Anterior to posterior. And then our final strip, posterior to anterior. So to close this off, then we're going back towards our 7cm EAB, and it's going to start on the anterior tibia, just in front of the tibial tuberosity, and we're going to wrap it all the way round, so we're closing off the distal end of our fan, back round to where we started, and then we're going to pinch the bottom of the tape and we're going to angle it up. So we're following that fan, going anterior to posterior, round here. Wrap it all the way around the thigh. Then we're going to go around a further time so we can close off all of the superior strips from our fan. And when we're back down towards the front again, we're going to angle it down. So we're going anterior to posterior. And finish the job just here. So that tape is going to be prone to coming off at a few different locations, namely here, here, and also where it finishes. So to close it all off and be certain that it doesn't come unstuck, we're going to be using 25mm zinc oxide tape. And this will wrap around the thigh, free from tension, just to try and minimise the impact or effect, minimise the risk of that tape becoming detached or unstuck. And the final bit of tape, we'll be doing the same thing, but at the distal end That will close off the final bit of tape where we finish the job, and also where it goes around that acute angle where it's at risk of coming off.